Okay. Hi guys, my name's Isha Thapar. I'm the editor-in-chief of Scientia, and I'm here with Brandon, Hannah, Madeline, Celine, and Jonathan discussing their paper, A Predictive Model Assessing External Suicide Risk Factors at the County Level. And we're going to talk a little bit about their research. So what was the purpose of this research?
So our intention with conducting this research project was to identify the key external risk factors that are most closely linked to suicide. So these are often under-researched in comparison to internal suicide risk factors, which are identified as mental illnesses or depression or substance abuse or alcohol abuse disorders. Um, so yeah, we wanted to primarily focus on external risk factors, which we thought could contribute more to ongoing suicide research. And ultimately, we just wanted to shed more light on mental health awareness, especially in relation to the ongoing pandemic. We thought this was a timely point to introduce more knowledge pertaining to suicide research, with predicted suicide rates going up in relation to the pandemic. Um, and just also, we want to contribute more to suicide prevention measures that can hopefully prevent the act of suicide. So, yes, our paper primarily focuses on external risk factors at the county level leading to suicide.
Awesome. And then what was your hypothesis?
So, based on the external risk factors that we chose to research, which were availability of mental health care facilities, median household income, and rural versus urban counties, we hypothesized that rural counties would report higher levels of suicide um, in comparison to urban counties, just due to aptitude of social isolation that could lead to the act of suicide. And we thought, or we predicted that um, those counties that had higher rates of median household income with lower income, that there would be higher rates of suicide in those counties. And we also predicted that with mental health care facilities, a higher prevalence of access to mental health care would be related to lower rates of suicide. Um, and then with the demographics that we chose to research, we hypothesized that low income, non white males 40 years and above would be the most at risk for suicide.
Great. And then what conclusions did you guys find?
Yeah, so I could talk a little bit about that. We came up with many conclusions as far as individual um, independent factors that played into the crude rate suicide by county. One of the main ones that we found to be or have the highest R square value was percent rural. So as percent rural increases in a county, so does the crude rate of suicide in that county. We also saw median household income with a negative correlation with crude rate suicide in a county. So as median household income in average in that county goes down, the suicide crude rate goes up. Furthermore, we extended our research a little bit more past that. So we took residual values. So we took the value that the county actually had for crude rate suicides in 2018 and subtracted that from what our program predicted them to have. And our program was really good at deciding which counties were actually in that formula, and it played out really well. But we had a couple outliers, and we think that's a really good place that we could keep doing research. So we had about 5 counties that were really big outliers, and we had around 20 that were had a T-score around 2, so not too big of outliers, but still definitely outliers. So we think this is a big area of research that we can keep going into. Furthermore, yeah, with these residual values, we saw many counties that had negative residual values and many that had positive residual values. So many counties that did much better than we predicted them to have, to do in 2018. So they had a lot less suicides than we predicted them to have. So in the future, we're hoping to delve deeper into these ideas of why these counties actually performed the way they did versus how our model predicted them to do.
Awesome. And then I think you already touched on this a little bit, but if you could, in what ways would you expand the study?
Yeah. Can you guys hear me all right? Yeah. Okay. So a lot of so in terms of like how we want to, how we'd like to expand this research in the future. So a lot of our data was limited first and foremost by the spreadsheets, the data that was available that we could find. So the primary thing that limited us in terms of like accuracy and precision, first and foremost, was the data set that we got from the CDC. So due to certain privacy laws, any county whose suicide rate was less than 10, or no, any county whose suicide number, so the number of suicides in a given year was less than 10, that number would be suppressed. And so there were a lot, I think it was over half of the counties, or at least a very significant number of counties had their numbers suppressed. So it would be nice to have access to those numbers, just to be able to create a more accurate and precise model. Yeah, so every county that's included in our model has a suicide number. The number of suicides in that county was greater than 10 for that given year. And yeah, it would also be nice to kind of look at other factors. So a big thing that took up a lot of time was finding appropriate proxies for the variables that we wanted to do. So what that means is like we often the data wouldn't be available for what we wanted to look at. For example, like for substance abuse, prevalence of mental health disorders, that was kind of difficult to find, especially at the county level across the United States. Just like finding the numbers, those often aren't available, or it doesn't really work, right? Because with this field, it's more quality over quantity, I guess, in terms of the data that's available. It's qualitative stuff. Yeah, so just being able to have more time to look around for those, and even maybe looking to make that data available somehow, whether it's through like national surveys, something like that. A lot of the difficulty was finding stuff at the county level. Like there's a lot of state level data, but county level data is where it gets very interesting and obscure. And yeah, so just even more time, we could explore more variables, really dive in deep to the underlying factors of suicidal thoughts, suicidal behavior, stuff like that. And yeah, so we'd also like to see our model developed into something more than just the data. So something that maybe like county health officials, even state level officials could use for like allocation of funds, maybe just seeing more resources devoted to mental health, suicide prevention. And yeah, because a lot of the data, well, there wasn't really much data available. So just being able to contribute to that pool of data, especially at the county level, I think would definitely do a lot of good for the field of healthcare in this country.
Great. And then what was your favorite part of the study?
I could talk about this one. So my favorite part of the study was just learning about all of the different factors that play into such a critical issue in society, which is suicide. And I think that the study also sheds light on the fact that most of the negative effects of the factors researched can be eliminated by effective resource allocation and professional help. Again, like Jonathan said, I think that the result of the study has significant potential to be used in spreading awareness of the issue, as well as helping determine which areas to allocate more resources to in the future in order to combat the issue.
Awesome. And then last question, is there any advice you would give to aspiring student researchers?
I'll take the last one. I was really thinking about this question And the two things that I thought of was this. Don't be afraid to try something different. When people think of research, they automatically go in their brain to bench research. They think of like chem lab. And I know as like a freshman, that was not my favorite. It's very important. It's beautiful. It's awesome. Was not my favorite. So I couldn't really see myself doing that. But our project is a great example. 4 out of 5 of us are pre-med, and this is sociological research. And it was so important. And suicide is a really important health issue. So I think it all ties back. So don't be afraid to do something different. It doesn't necessarily need to be bench research. And then my second thing is just lean into your curiosities. Research is all about asking questions. Why does it work like this? What causes this? It's getting to the deeper issue of something. So if there's a class you're super interested in, if there's an area of like science research or sociological research or psychology that just fascinates you, that is what you should be leaning into. That is where you should be finding internships and speaking with faculty about their projects, just based off of your interests.
Great advice. Awesome, guys. Thank you so much.